A luxury cruise? A deadly outbreak scare? And now nearly 2,000 passengers trapped on board a ship docked in France. As illness spreads through the vessel and authorities impose a sudden lockdown, one chilling question is now haunting everyone on board. Is this a routine outbreak or the beginning of something far worse? A luxury cruise holiday has turned into a health emergency off the French coast. More than 1,700 passengers and crew members have now been confined to a cruise ship in Bordeaux after a suspected norovirus outbreak spread on board. With dozens reporting symptoms, medical teams dispatched to the vessel, and one passenger already dead during the voyage, authorities are racing to determine whether the virus is still spreading through the ship. French authorities confirmed that the cruise vessel Ambition was placed under restrictions after arriving in Bordeaux on Tuesday, carrying more than 1,200 passengers, most of them British and Irish nationals. Health officials said around 50 people on board had shown symptoms consistent with norovirus, a highly contagious gastrointestinal illness that commonly spreads in confined environments such as cruise ships, hospitals, and care homes. The vessel is operated by Ambassador Cruise Line and was on a 14-night voyage that departed Belfast on Friday before embarking additional passengers in Liverpool on Saturday. According to figures released by the cruise operator, the number of illness cases increased following the Liverpool embarkation. The outbreak comes amid heightened concern after a 92-year-old passenger died during the cruise on Sunday. However, the cruise operator stated that the guest had not reported any symptoms of gastrointestinal illness before their death. The company added that the exact cause of death has not yet been established and remains subject to a full coroner's report.
We would like to reassure guests that we take any illnesses aboard our fleet extremely seriously. Enhanced sanitation and prevention protocols were immediately implemented across the ship in line with established public health procedures following the initial reports of illness.
Guests were also advised to follow strict hygiene measures, including regular hand washing, use of hand sanitizer, and immediate reporting of any symptoms to the onboard medical team.
The comprehensive health and safety measures introduced include increased cleaning and disinfection measures in public areas, assisted service in selected dining venues, and ongoing guidance to guests regarding hand hygiene, including regular hand washing, use of hand sanitizers, and the prompt reporting of any symptoms to the onboard medical team.
The cruise operator confirmed that all medical consultations relating to gastrointestinal illness were being provided free of charge during the incident. Ambassador Cruise Line said a specialist medical team and sanitation consultants had been dispatched to the vessel to assist with the investigation and containment measures.
While the investigation and testing are ongoing, all guests and crew have been instructed to remain on board under the direction of the local shore authorities. Once clearance is granted, guests will be permitted to disembark.
Norovirus outbreaks are not uncommon aboard cruise ships because the virus spreads rapidly through contaminated surfaces, food, water, and close personal contact. Symptoms often include vomiting, diarrhea, stomach cramps, and fever. Health authorities across Europe and the United States are scrambling to contain the deadly Hantavirus outbreak linked to the expedition cruise ship MV Hondius, after a Dutch hospital quarantined 12 staff members who handled contaminated patient samples without using the strictest safety procedures. The staff at Radboud University Medical Center in the Dutch city of Nijmegen will remain in quarantine for 6 weeks as a precaution after coming into contact with blood and urine from an infected passenger. Dutch Health Minister Sophie Hermans admitted before Parliament that hospital protocols were not fully followed.
What happened at the Radboud Hospital in Nijmegen is that strict procedures were followed there, but not the very strictest procedures that apply in the case of this hantavirus. This concerns the taking of blood and the disposal of urine from the patient who is currently being treated at Radboud UMC.
Herman said the exposure involved the handling of blood samples and disposal of urine from a patient currently being treated at the hospital.
Chair, the chance that staff were infected as a result is small, but because we know that we are dealing with a serious virus here, Radboud UMC has said we are erring on the side of caution. We know this is a drastic measure with a major impact, but we are taking it nonetheless, precisely because we want to err on the side of caution and because we want to do everything to pull out all the stops to prevent the spread of the virus.
The outbreak has now spread across multiple countries after passengers disembarked from the ship, which had sailed from South America before docking near Tenerife. Authorities say all suspected cases have been isolated and placed under strict medical supervision. The Andes strain of Hantavirus involved in the outbreak is considered particularly dangerous because, unlike most hantaviruses, it can spread between humans. 3 people have died so far, including a Dutch couple believed to have first contracted the virus during travel in South America before boarding the ship. France has also intensified emergency measures after 1 infected passenger was admitted to intensive care in Paris. French Health Minister Stéphanie Rist told Parliament on May 12th that scientists still do not fully understand the outbreak.
There are things that we know about this virus, and that is rather good news. It is a virus known since the 1990s, a virus that has person-to-person transmission, a virus that can make people sick, very sick, even cause patients to die. But there are also, and you have said it, things that we do not know about this virus. For example, the place where the first person who died contracted the virus, or for example, we do not yet have the complete sequencing of the virus, which allows us to say with certainty today, even if we are rather reassured to date, we do not have the certainty to say that this virus has not yet mutated.
French officials say 5 French nationals from the ship are now in quarantine, including 1 critically ill woman receiving advanced life support treatment. Dr. Xavier Lescure at Bichat Hospital said the patient has suffered severe lung and heart complications and is now connected to an artificial lung device.
The patient currently has the most severe form of cardiopulmonary presentation and is receiving what is at the final stage of supportive care, extracorporeal circulation for artificial oxygenation. She has a heart-lung machine, a blood diversion, which we hope will allow her to get through this critical period while her lung, damaged by the virus, and the vascular wall recover.
Meanwhile, Dutch authorities say the MV Hondius has now departed for the Netherlands after its final passengers disembarked in Spain, as international investigators continue tracing contacts and searching for the exact source of the outbreak. The World Health Organization has raised the number of confirmed cases to 9, with 2 additional suspected infections under investigation. WHO Director General Tedros Adhanom Ghebreyesus warned that more infections could still emerge due to the virus's long incubation period.
At the moment, there is no sign that we are seeing the start of a larger outbreak. But of course, the situation could change. And given the long incubation period of the virus, it's possible we might see more cases in the coming weeks. Viruses do not respect borders. Our strongest immunity is solidarity. And that's the solidarity that Spain has demonstrated.
As investigations continue, health officials warn the coming weeks could determine whether the outbreak remains contained or escalates internationally.